So in US and largely in other countries, other than the MBBS doctors or allopathic doctors, even the nurses are considered as semi doctors, meaning they have rights and they have authorities to prescribe certain allopathic medicines. But in India, such a thing is non-existent. So these, allopathic doctors and the whole of the allopathic community, they have kind of a, they have made a system in which they are the sole authority to prescribe allopathic medicines. The one of the disadvantages of that is, for example, for Kshara Sutra application, or even in Ayurveda, also many surgeries are explained for which we may need a little bit of help in terms of anesthetics, etc. So we also may need some allopathic medicines. But in a landmark decision, this Odisha government they have allowed pharmacists at primary health centers. So these primary health centers are government-run centers. So they, which are managed by single doc with or without doctor. The Odisha government has given the power and authority for the non-medical staff there to treat these certain diseases like malaria, fever. So common disease, for these common diseases, the staff is empowered with the power to prescribe certain medicines, albeit it will be limited, it will be for certain period of time and all. But I feel this is kind of a landmark decision because for decades together, the authority of allopathic medicine is held tightly with the MBBS community.
See, this is a important issue. It's going on since time immemorial. Since 1947, when the Indian got independence, that time also there was issues, and that's the reason the National Integrated Medical Association has come into play. And that integration was a choice by thing that everybody wanted to have it. But unfortunately, with some or the other way, it is not happened till date. But across India, in many states, it has been allowed even for the Ayurvedic doctors to prescribe. And of course, in certain areas, that type of government orders being challenged by the allopathy community in court, and it is now also such one case is going on in Supreme Court, where it is Delhi government versus Ayurvedic doctors that has been case. And of course, this type of things are very common. But here, for allowing an Ayurvedic doctor to prescribe to some extent some allopathic medicines, at least we can say that these doctors have learned basic physiology, anatomy, pathology, pharmacology, and these things at their degree level. And they should be allowed to some extent, of course, with some restrictions, to some extent that can be allowed. That is, can be considered as somewhat okay. But a pharmacist allowing or even a nurse directly giving a prescription, it is somewhat as a difficulty is there. But what is the difficulty means? Who is going to diagnose the condition for them? They may be pharmacists may be knowing what should be the drug should be given to which disease. But who will going to diagnose that this patient is of malaria, this patient is of scabies, and this patient is of diarrhea, and it's a bacterial diarrhea, or it is a viral diarrhea? Who is going to diagnose these conditions? So it's a difficult. Before doing that one, they need to give some sort of training even to the pharmacist. There should be some short-term courses to train them in these areas, or which are the diseases which usually in the rural areas of Odisha what they come across, and where they are feeling a shortage of doctors. In those areas, if you want to go with the other alternatives, then in order to bring that alternative thing, we need to go for very clearly certain training for the even the staff. If you give proper training for identifying the conditions or diagnosing the condition, then they can give the treatment or even the prescription to a basic level that can be done.
Yeah, I mean, rather than directly going into the, like you said, the pharmacist and the nurse, better that some of the rights are distributed to the Ayush doctors, because next to the allopathy, the most of the medical knowledge is carried by us in terms of modern medicine knowledge. So that would be a better step, and then like you said, with training, even pharmacists and other people can be brought into the group, sir.
But there is a lot of other issues connected with this. But definitely, that allopathic community is going to go against this because they feel that we are trying to take out or remove their bread and butter, or we are, and they are the feeling they are have a feeling that they are the leaders in the area. If somebody ventures, some different person from a different level has come into this thing, and they may establish their facts later, so that may not be digestible to them. So they're keeping hold with the age-old rules and regulations of India, which has been in practice. So they're hanging on to that and making the things worst. But in present situation, we need to go for integration. Integration is the best method for giving the patient best results.
Regarding turning the whole of the medical syllabus into an integrated one, are you pro or against the idea, sir?
See, we should not go directly to integrate the entire thing and make it a 1 degree. That should not be done. That may have some beautiful Ayurveda concept may be just thrown out, and some allopathic beautiful concept may be thrown out. That becomes a problem. So that should not be done. Let these 2 degrees run parallelly, compelling after completing of the first level of degree. Then let us have some sort of bridge course, something where people of the alternative system of medicine or the Ayurveda and these Indian system of medicine people will be given training in the Western system of medicine, and the Western system people will be trained in the Ayurvedic system of medicine, or the whatever the thing they like it. Then according after doing these type of bridge courses, then both will have some sort of integration and respect to the subject, and as well they'll be knowing the subject. So that will be better, and they can cater this their services in a better manner to the public.